The views and opinions expressed on this program are those of the participants and do not reflect the views of BronxNet or the program underwriters.
BronxNet. Your voice, your views, your vision.
Good evening. I am Errol Schneer, Bronx Lebanon Hospital Center's Vice President of Planning, Marketing, and Public Relations, your co-host for tonight's HealthBeat television program. We welcome you, our many viewers, to HealthBeat, and we encourage you to please continue participating in the program by calling 718-960-7241 with any healthcare questions you may have. That's 718-960-7241. As always, we promise to do our very best to keep you medically informed and healthy by discussing the medical topics that are of interest to you, the Bronx community. Please tune in every Monday evening from 6:30 to 7 p.m. on Channel 67, and you can also find out more information about Bronx Lebanon and its many community services online at our website, bronxcare.org. Tonight, my co-host, Dr. Milton Gums, Bronx Lebanon's Vice President and Medical Director, and I will be discussing the important role of pharmacists in the healthcare system.
Yes, Errol, there is no doubt that the pharmacists are taking on a vital role in providing patients with the prescriptions they need. Joining us this evening is Dr. Bessman, lead pharmacist at Bronx Lebanon Hospital Center. Dr. Bessman has close to 20 years of experience as a pharmacist and is widely acknowledged for his expertise in the field.
Now, before we hear from Dr. Bessman, let me encourage you, our viewers, to call in with any questions or comments you may have. The number to call is 718-960-7241. That's 718-960-7241, and please call us. Now, Dr. Bessman, let me start the program by asking you to share with our viewers a description of the important role of pharmacists in our healthcare system.
Oh, that is a very good question. A pharmacist is a very important medical worker in our healthcare system, and they provide a very good wealth of information regarding the medications we use, the way we use it, and they also assist the physicians to make sure that the patients receive these medications and they get well and they have little or no side effects on this. So in short, our medications, which the pharmacist has a very good knowledge of, in fact we call them experts in this area, is a very important role that are given to the society so that everybody is well and we don't suffer any unnecessary hardships from that.
Expanding a little on Mr. Schneer's question, what's the difference between a pharmacist in a hospital and another pharmacist who works in the community setting or retail setting?
On the surface, there is, it looks like there is no difference. They go to the same school, they have the same degrees, right. Especially now that everybody has to do a 6-year course to get a PharmD. So, but when you look a little bit deeper, there's a little, there is some differences between a hospital pharmacist and a retail pharmacist. The retail pharmacists, as a matter of fact, meet patients more. You know, they are in close contact with patients more than the hospital pharmacist. On the other hand, the hospital pharmacist is close to the medical practitioners who are also in contact with the patients. So that degree of closeness there, matters, because while the retail pharmacist helps these people see them day to day, the pharmacist who works with the doctors actually helps the patients indirectly by helping the doctor to make the proper choices for their medications. So, you can see that major difference there. Having greater contact with the patients from the community, the hospital pharmacist working indirectly with the doctor to help the same patients.
Okay.
So,
Right. Now, another question that comes up, Dr. Bestman, is how you and other hospital pharmacists interact with nurses, with doctors such as Dr. Gums, and with other hospital staff in determining what's best for the patient.
Yeah, that is, is close to what we just said right now. The doctors, the nurses, and the pharmacists do what we call ground rounds.
Right.
Yeah, they move around with the, to the patient beds, look at the patient charts, and see what is happening with the patients. Everybody brings his or her own expertise
Right.
in their own fields
Right.
of study. And in making decisions regarding the welfare of the patient, which is very important, the primary purpose for doing those ground rounds, the pharmacist is there to supply very proper information and adequate information that will help the physician, the dentist, the nurse to choose appropriate medications and care for the patient.
Right.
Well, now would be a good time to share with our viewers a typical work day for you working in a hospital. Typical work day. Starts at 9?
Yeah, I start at 8, as a matter of fact.
Okay.
I work a long day, actually. And, you start in the morning when we come in, and then you make sure everything is there. You make sure the medications that were dispensed on the previous day are, sufficient and was sent on time to the patients. In fact, the primary thing you do is you walk in, you check your work the last day, and then you start the day's work. Mm-hmm. And the day's work includes making the ground rounds we earlier discussed, and processing patients' prescriptions, answering calls from doctors and making recommendations. And sometimes you do some, I will call it very unrelated jobs or activities that indirectly also help the patient, because if something breaks down in the nursing station that has something to do with the pharmacist, you have to go in and help. So your job is constantly making sure the patients are taken care of by doing everything you can from the position, and ensuring that the patient is adequately taken care of. And you do that by walking back and forth, standing on your feet the whole day. Our job is not a job where you sit down and talk. You have to move around, because you have to meet patients, especially if you are in the outpatient section of the pharmacy.
Okay.
Now, how do the prescription drugs, or the pharmaceuticals, so to speak, get from your pharmacy to the patient floor?
Or the
What happens in that process?
Yeah, the medications come from pharmaceutical industry through recognized distributors, and then that comes to the pharmacy, because you have to order those medications,
Right.
which has to match the hospital formulary. Every hospital has a set of formulary drugs,
Right.
which you have to choose from. We don't carry everything; it's not possible.
Right.
And then you get those drugs. When you do their ground rounds, you go with the doctors, you make recommendations, the doctors write these orders. These orders are, verified to make sure that they are adequate
Right.
for the patient. And then that is dispensed through a system, a very sophisticated system, which we have in Bronx, Lebanon, where the medications is verified by the pharmacist, and the nurse picks it up from a machine called the P6, which has the patient's name. In that case, the nurse can never pick something that is wrong for somebody else.
So the medication is directly on the
Directly,
unit.
yeah.
So that's
it's
a
picked up.
major advantage
Exactly,
to
yeah,
patients.
yeah.
Okay.
I have a two-part question. Suppose a patient has a severe side effect, an adverse response to the medication. What should the patient do? And is there a timeline on this? That's the first part.
Yeah, remember every medication has side effects.
Yeah.
Now, when you have a severe side effect from a medication that you have taken, the first thing you do is you call your medical practitioner or your doctor. But if that adverse effect or side effect is life-threatening and it's not possible to get to a doctor right away, the best thing you do is you call 911 or you go to the emergency room because you don't exactly know what can happen to you in the next minute.
But typically, what do pharmacists tell patients when they see them?
When pharmacists see patients, normally you see a patient who is coming in to
get medication,
okay. Either fill a prescription or buy over-the-counter drugs. These are all important things. And you got to look at the prescription to make sure it is properly prescribed, the doses are appropriate for the patient, and the disease condition for which the patient does have. And if it is over-the-counter, you make sure the patient is purchasing the right medication, because you must have known the patient's medical conditions.
Is there any possibility of the pharmacist asking the patient what other medications you're on to see side effects with medications?
You are asking about whether you can make recommendations for other medications.
No. Do you ask the patient what other medications you're on?
Oh yeah, because that's why when a patient comes to you, you have a profile of that patient.
Okay.
If you don't have the profile, you ask the patient what medications the patient has been taking in the past and presently, because you have to look at those medications, weigh in the risks and benefits, the drug interaction, and so on and so forth.
Okay. We have a caller. Albert, you're on the line. Can you give us your question?
Yes, sir, Dr. Gumps. Thank you for taking my call. I have actually two questions. My first question is I've been put on a aspirin regimen due to my age to reduce the risk of heart attack. And I wanted to ask the pharmacist if there would be any problem with my stomach taking the aspirins every day.
You heard the question. He's on an aspirin regimen for his heart.
Okay.
And he's concerned about what side effects you can have.
Yeah, I think it's important to take your medication, but again, you must be able to watch out for the side effects. When these people come in,
aspirin. He wants to know specifically about aspirin. He's
taking
aspirin.
That's what I'm going to. If he's taking aspirin, every medication has side effect.
Okay.
And aspirin has side effect too. It has its own benefits too. So if the side effects of the aspirin outweighs the benefits, you got to contact your doctor. But again, if the doctor asks you to take the aspirin, you should take it. But you have to bear in mind that taking aspirin has its own.
So can he take a stomach remedy on top of the aspirin, or can he take an aspirin that might be coated, for example, with some kind of...
Enterocoated aspirin or regular aspirin both have similar side effects here. But the other one is gentler to the stomach than the other one,
Okay. What's the second question, Albert?
Yes, thank you, doctor. My second question is there really anything to the vitamin C and colds? Is there anything would the vitamin C actually prevent the cold, or will I get better faster and stuff like that?
Vitamin C for the cold. Should he take vitamin C before he gets the cold, or should he take it when he gets the cold? And if he gets it, does it make the cold go away quicker?
There is the psychology of people taking different kinds of things and feeling better. If you take vitamin C and get better, there is some psychology in that. But there's no studies that prove that it does solve the problem, because cold actually is a viral infection.
Albert, for this winter, I took vitamin C 500 milligrams every day, and up to now I haven't got the virus. So I recommend it strongly, no matter what Dr. Bestman says.
Thank you so much.
That's what I said.
That's
what I said. It is psychological. Yeah.
Now, in terms of side effects, we often see advertisements on television for all types of drugs, and after you see the advertisement, it's followed by a tremendous number of side effects. How would you comment on that?
Yeah, again, as I said earlier, every drug has side effects, and that shouldn't scare anyone from taking the medication. That is why you have the pharmacists, you have the doctors, you have a prescription. Try to talk to your pharmacist,
right,
and try to talk to your doctors, and they will be able to tell you what you should be watching out while you are taking these medications.
Right. Sure. Another question that our consumers often ask is, when drugs expire, there's an expiration date on them. Can they still use those drugs after the expiration date? What's the general recommendation there, or comment?
Yeah, there is a purpose for putting expiration dates on medications. What it says, the manufacturer is telling us, is that at a certain time, up to the time the drug expires, they guarantee the potency and the therapeutic effectiveness of that drug. After that date, they don't guarantee anything.
So doesn't mean that should they throw the prescription?
It doesn't mean that the drug is bad, but is a guarantee that if you take it after that, you are on your own. The drug, I really sympathize with people who probably might have headache, going in to look for their medication only to find out that it is expired and is a throbbing headache. So there is a dilemma there. What do I do? Do I carry my headache, or do I take something that expired? So that is where your health practitioner comes in.
All right.
Okay.
And a last note, in terms of refrigerating pharmaceuticals, what is your recommendation?
Well, before we answer that question, let me get to Jennifer. Jennifer, you have a question?
Yes, please, I do. For patients, diabetic patients who do not like to be injected with a needle, are there any other ways of getting medication, maybe by pills?
Did you hear the question?
Instead of insulin?
A patient who's diabetic, who doesn't want to take the injection.
Okay. There are the oral diabetic medication, there are so many of them, and there are new ones coming up. So he could ask for alternatives to the injection. But if the injection is necessary, it might be necessary for them to...
Many of the solution, the needles, the needles that you use are almost painless now.
Yeah, there are new ones now that are coming out that doesn't give you much pain, like using the regular needles.
Right.
Yeah.
But in responding to the viewer's question, there are alternatives out there.
Absolutely.
Other than
not always.
Not always.
Okay. Okay, you want to ask your question? Thank you, Jennifer.
In terms of refrigerating prescription drugs, what is your recommendation?
If any medication that requires refrigeration is stated on the case of the medication, and that should be put in there, because by leaving it in the refrigerator, the potency is maintained.
Okay.
Yeah.
Okay. And at this point, let me now pause for a short break. And when we return, we will continue our discussion as well as take calls from you, our viewers. Once again, the number to call is 718-960-7241. That's 718-960-7241. And please call us.
During this, our year of orthopedics, we recognize the extraordinary accomplishments of the orthopedic team. We also take pride in our new ambulatory care facility, which will include an entire floor dedicated to orthopedic services.
We have established a world-class orthopedic program here at Bronx, Lebanon. Our dedicated surgeons and professional staff offer exceptional services for hip, knee, and shoulder replacements, spine, hand, and foot surgery, trauma care, and sports medicine.
Crucial to orthopedic surgery and the operative process are the anesthesiologists.
The orthopedic surgeons depend on the anesthesiologist to keep their patients safe during the surgery. But most importantly, they rely on us to keep their patients pain-free.
And nurses at Bronx, Lebanon are taking on pivotal roles as key members of the OR team.
Our highly trained staff provides essential assistance to the orthopedic surgeons, as well as specialized care and attention to patients prior to and following their operation.
Surgery can be stressful for elderly patients or those with serious medical problems. These high-risk patients often require follow-up post-operative care in the ICU.
Our critical care physicians, in collaboration with the orthopedic team, are addressing the serious medical problems and the complications that occur following surgery.
In the Women's Health Center, screenings are performed to detect bone problems related to genetic factors and the aging process.
Our GYN team cares for women with osteoporosis for its prevention and treatment.
Many of Bronx, Lebanon's orthopedic patients first come through its emergency room.
Our staff works closely with the orthopedic team to respond immediately to injuries resulting from falls, sports injuries, automobile and bicycle accidents, and other forms of trauma to the extremities and spine.
And Bronx, Lebanon is also leading the way in internal medicine, ear, nose, and throat, surgery, neonatology, ophthalmology, family medicine, pediatrics, radiology, psychiatry, dentistry, pathology, and long-term care. Its Bronx Care Network is fulfilling the hospital's essential role as doctor to the community.
Welcome back to HealthBeat. We come to you live on BronxNet every Monday evening from 6:30 to 7 p.m. Please call us at 718-960-7241 with any questions you may have, and we will certainly do our best to answer them. That's 718-960-7241. Now let's continue our discussion. Dr. Bestman, a question we often ask our panelists is to share their respective backgrounds with our viewers, as well as also indicated what interested them in the field, in pursuing a career in the field. Can you share that with our viewers?
Absolutely, yeah. I started my career not necessarily in the pharmacy profession. I was actually a teacher.
Yes.
I taught in high school and elementary school. And then when I came into this country, I thought I should do something different, especially when I saw what was going on in developing countries regarding the way medications are, handled. And I thought I should make a difference over there. So I got into pharmacy school for that. I did the first 5 years to get my Bachelor in Science in Pharmacy from Long Island University. And I graduated and then had some practice in the retail in New Jersey for a short period of time. And then did some again in the Bronx for a short period of time. And then before I came in to Bronx Lebanon Hospital. And a couple of years later, I went to University of Florida to do my PharmD. And then after that, I've been practicing in Bronx Lebanon now for almost more than 15 years, and I'm very happy on what I'm doing. And I feel that I'm contributing to the wellness of the population that I serve. And I can now think of what I can do in my country to improve the administration of medication.
I don't want to rush you. I know you have a long history. What's the difference between generic and brand?
The difference is significant. The brand is made a company, a pharmaceutical company, decides to be the original innovator in discovering a particular medication, and they develop that. It costs a lot of money.
Yeah. Generic is cheaper or brand is better? What's the advantages?
They are bioequivalent. But if you, in terms of cost, the generic is lower because they do not spend the amount of money the original company spent in developing the drug.
Okay, thank you. Mary, you have a call. You have a question for us. Can you give us quickly, please?
Yes, hi. I'm calling because my question is, what about patients that are disabled?
Patients that are disabled.
Okay.
What's the question?
Excuse me?
What's the question again, please?
The patients that are disabled, how do they get their medication?
Patients who are disabled, how do they get their medication?
Oh, okay. There are some pharmacy, especially retail pharmacies, and even hospitals that have facilities for disabled people. And there are mail order pharmacies where you can send your prescription to without having to struggle with traffic or what have you. So there are arrangements for people who are disabled.
Yeah. Okay. There. You heard the answer. I guess you were asking something else also. Oh, we lost her. Okay, Mary. Thank you very much.
Okay. Now, what types of opportunities do you see available in the pharmaceutical field for individuals that want to follow your own career pathway?
Wonderful opportunities, great opportunities. It depends on what you want to do, and this is a very interesting profession.
Right.
You can be a retail pharmacist, you can work in the industry, you can be a professor in pharmacy.
Good outlook.
Something that I have to ask.
Yeah.
What about the overuse of antibiotics? Is that a problem?
Yeah, it's a problem. There's
you can elaborate a little more.
Yeah. When you take that a lot, it might cause a resistance. And if you actually is sick with something, with a disease in which antibiotic is needed, you might have problems, getting cured. So you limit the amount of antibiotics. Doctors tell you that anyway.
Okay, now what about individuals that are prescribed more than one drug? How do you you work with the physicians in terms of developing a plan where there's no interactions or limiting the challenge associated with interactions?
It is in the choice. That's why we do the rounds. We should have a profile the patients make, and then we should ask questions. That tells us the total number of drugs, and then we know from our studies and expertise what drugs could cause
what about the patient who goes home with 6 or 7 medications? How do you make sure the patient understands when and how to take the medication?
That is when counseling comes into effect. You got to tell the patient what the medication is all about, the amount the patient should take, the time to take it, and the possible side effects and drug interactions.
Yeah.
Okay, and lastly, how do you make sure that patient safety is always maintained? That's something I know that's very important.
Yeah, the patient's safety is maintained by looking at the drugs the patient is taking, the possible side effects of the drug, and the overall food and other things the patient is taking
so it's an issue that pharmacists such as yourself are always on top of.
Yeah, that is very important for the welfare of the patient.
Okay, and on that note, Dr. Bestman, let me thank you for joining with Dr. Gums and myself on tonight's HealthBeat television program. And most importantly, let me thank you, our viewers, for joining with us this evening.
In the interim, if you have a medical question or need assistance, I encourage you to call our physician referral service by dialing 718-99 That is 718-992-7669. Or you can refer to our website at bronxcare.org. Good night, and we'll see you next week when we'll be discussing pediatrics and caring for children.
Clean kitchen surfaces